Hello, Jennifer. We see that you recently visited St. Elsewhere Hospital. Your provider was Dr. Emergency and your diagnosis was low back strain. Your video discharge instructions are coming up next. We will then display your follow-up information including your referral physician and contact information.
The back is a complicated arrangement of bones, muscles, ligaments, and nerves. Damage or injury to any of these can cause pain. The bones of the back make up the spine. There is an upper, middle, and lower spine. These bones, called vertebrae, are stacked on top of each other and fit together like pieces in a jigsaw puzzle. In between the bones are shock absorbers called discs. Like any bone, a vertebrae can become fractured from an injury, such as a fall or car accident. A different type of fracture can occur in older patients, called a compression fracture. This can happen without any kind of accident or injury, just from the bones becoming brittle with age. These are most common in the middle and lower back. Fractures that do not push on nerves or other important structures can often be safely treated at home with rest, ice, and pain relievers. Sometimes the shock absorbers or discs themselves can cause problems when they bulge out of their normal space to push on other structures of the back, such as nerves. The spinal cord runs up and down the center of the bones of the back, protected inside the spinal canal. Like a large electrical cable in the wall of your house, it sends off wires, or nerve roots, as it moves down through the spine. Many of these nerve roots pass through openings in the bones. If an opening in the bone is narrowed for any reason, the nerve can be pushed on or pinched. This is one common cause of pain in the back. One very important nerve in the lower back, called the sciatic nerve, powers and provides feeling to the entire leg. Problems with the sciatic nerve are common and often begin as a burning sensation to the buttock and down the back of the affected leg. This condition is often referred to as sciatica. A series of muscles run up and down the entire back, providing important support to the spine. Along the outer back, these muscles are very long and powerful. There are many layers of back muscles, and as they get deeper and closer to the bone, they tend to be shorter. A stretched or torn muscle or muscles in the back is another very common cause for back pain. This may be the result of a sports injury or trauma, or happen spontaneously while lifting or bending. Fortunately, most back pain is not serious and will get better on its own. If your back pain is from a stretched or torn muscle, allowing the muscle to heal is very important. That involves following a series of back stretching exercises which you may have been provided. While recovering from injury, it is important not to place any stress on the low back. Avoid all lifting, running, or prolonged standing. Try and change position of legs and lower body regularly throughout the day. You can resume these activities when your treating physician indicates that it is safe to do so. Once the healing has begun, it is very important to continue the exercises, which not only help stretch the muscles, but also strengthen them as well. Keeping muscles limber and strong is your key to avoiding re-injury in the future. Ice is typically used during the first 24 hours after a back injury to relieve pain and reduce swelling and inflammation. If the pain is due to a bone or joint problem, continue to use ice. If the pain is the result of a muscle problem, then after the first 24 hours, you may get good results from a heating pad. If using ice packs or heat, apply every 4 hours as needed. Be certain never to apply ice or heat directly to the skin, as this can cause damage. Medications most commonly prescribed for back pain include anti-inflammatory agents, muscle relaxers, and sometimes narcotics.
We take your care seriously and appreciate the trust you've shown in us. We hope this video discharge instruction contributes to your recovery. This video will remain available in your personal health record secure in our hospital portal. We encourage you to watch it as often as you feel necessary.